Marina Maiero. I'm technical officer in the climate change and health team at WHO. I will be your moderator for this fantastic session, the first one on climate change and health just after the COP26. So very, very happy to moderate this discussion and to look for more interaction and collaboration, and looking forward to this very exciting, what is looking like a very exciting exchange. But before going through the program and inviting our speaker to give the presentation, I would love to hand over for a quick housekeeping message to Bruce Sturminger, the Senior Associate Director of ECHO Project that is supporting us organizing this event. So Bruce, over to you.
Thank you, Marina, and welcome everyone. Thank you for joining today. I'm just going to run through a few housekeeping items. First being that we have interpretation available in several languages, including French, Portuguese, Spanish, and Russian. And you can access the interpretation by clicking on the interpretation globe at the bottom right of the Zoom toolbar. If you only want to listen to the interpreted language, you can click mute original audio. Otherwise, you'll hear faintly the original audio as well. Next slide, please. We really look forward to your questions and your comments. This is a big topic and a really important one, and we just want to hear as many of your thoughts as possible. So please put those questions and comments in the Q&A feature just to the left of the interpretation icon at the bottom of the Zoom toolbar. If you have any IT or logistic questions or questions about the certificate of attendance, please put those in the chat and we'll try to address them as best we can. Next slide. We are recording today's session and your attendance is consent to be recorded, so thank you for that. We'll be sharing actually all the recordings in the different languages after the webinar, and we'll be sharing those through a follow-up email and through a number of different venues to access them. We will be offering certificates of attendance. That's through the University of New Mexico, where Project ECHO is based. We'll share a link in the chat about 15 minutes before the end of the session. That will lead to a brief 3 to 4 minute survey that's anonymous. We really look forward to your feedback. It will help guide planning for future sessions. So please take advantage of that opportunity. Next slide. Just a quick note about data use and data stewardship. We take data stewardship very seriously, and all the data you shared when you registered is kept very secure. It's all being shared with WHO, the sponsor of this learning event. And we thank you for joining. And with that, back to you, Marina.
Thank you very much, Bruce. And well, to start this webinar, we'd love to really play something super powerful, a video that was just produced for the COP26. And sorry, I meant 26 before also, as like everybody knows what is it. I guess it's common knowledge at this stage, but it's the big conference on climate change that just ended this weekend in Glasgow. We will hear more about the conference from our panelists, but then I really would like to start this webinar playing this very powerful video with super powerful message from the health community at COP26. So I hand over back to our ECHO colleague for playing this video. Thanks.
I have seen rising rates of heat exhaustion,
depression,
double the normal number of asthma exacerbations,
cardiovasculares, infartos, stroke,
problems with kidneys, heart, and lungs.
I've seen children die due to the air quality on our streets.
من الإصابات الميكروبية المتنقلة من الحيوانات.
And the worsening of psychiatric illnesses.
Stress and anxiety of not knowing, is this flood going to come again?
When the Category 4 typhoon made its landfall, the hospital's basement flooded. heat waves close to 50 degrees.
The unprecedented droughts and locust infestations.
Les vagues de chaleur de plus en plus longues, de plus en plus fréquentes et de plus en plus chaudes rendent les patients de plus en plus malades.
I prescribe healthy air as a right for all children.
I prescribe the rich nations to make the biggest cuts in emissions.
D'investir massivement dans des projets d'adaptation climatique qui touchent la santé.
To invest in reversal of the negative impacts.
To build resilience.
E risolvere le disuguaglianze sanitarie e sociali.
Y dejen de financiar
of fossil fuels.
Climate change is a health emergency, and it is my ethical duty to speak about it.
We have a crisis.
So 48 million doctors, nurses, and health workers around the world signed this letter. We hear more about this during this webinar. And then let me introduce.
I have seen rise.
Oops. And let me introduce, and it's my great pleasure to introduce for some opening remarks our chief nurses in WHO, Elizabeth Hero. Elizabeth, she has been appointed by Dr. Tedros as chief nurses in 2017, and she's from Cook Islands, where she was working before joining WHO as a Secretary Health, and really interesting to learn also reading your bio, Elizabeth, that you are the first woman, a nurse midwife, to be appointed in that position, and we're very honored to have you in WHO here. And without further ado, I hand over to you for some opening remarks.
Thank you very much, Marina. Greetings to our eminent speakers on the panel, and welcome to all who have joined us on this live radio session today. Climate change is a public health issue, and the adverse health effects demands actions from nurses and midwives. Although many of in our profession have varying levels of knowledge about climate change and its relationship to health and practice, we have an obligation to be educated and to be engaged. We are well positioned to expand our role. Not only are nurses and midwives critical to every aspect of health promotion and patient care, they remain one of the most trusted professionals worldwide and have the power to effect change through strong communication and advocacy about climate change. We are seeing the severe toll on our patients and our communities, increasing sickness and deaths from heat waves and pollution, exacerbating asthma and other respiratory illness, increasing disease vectors like Zika, TB, injuries and loss of livelihood and mental health issues as a result of floods, hurricanes, and wildfires. Nurses and midwives are closer to the people in vulnerable communities to climate change, and in many cases are the only health and care provider there. They have essential roles in both reducing and responding to the health consequences of climate change, and the World Health Organization's Global Strategic Direction for Nursing and Midwifery 2021 to 2025, with policy priorities in education, leadership, and service delivery, can support our nurses and midwives to advance in this area. Additionally, the WHO Nursing and Midwifery Community of Practice recently established at the request of nurses and midwives offers the opportunity to continue our climate change conversation further. With your commitment and network of nurses and midwives, we can share best practices, knowledge and experience to protect the health of our patients, families and communities from the impacts of climate change. And thank you.
Thank you, Elizabeth, thank you. And before starting our dialogue, I think it would be nice to understand which are like the understanding expertise of the audience that is connected with us today. So I would love to launch a poll a question for all of you to answer. So I will ask again support and help from Project ECHO for launching this poll. I would read for you the question as soon as they will be on video. Can we have the poll question? Well, while we are waiting for, okay, the slide is here, thank you. So we'd love to ask you, how would you rate your knowledge about climate change and health? You only have a single choice. You can choose between none, basic, reasonable, good, and expert. So we'll give you a few seconds, you just have to click on one of these options. We'd love to hear from you. As soon as we have the statistics with the results, we'd love to invite also our colleague from ECHO. Okay, here we are. So we have an audience with only 9% is defining themselves like not knowing anything about climate change and health. I'm sure we'll learn a lot during the course of this webinar. Basic, 32%, reasonable, 34%, good, 22%, and expert, 3%. I'm sure we have very humble participants that don't want to define themselves expert, but I'm sure there are many of you who knows, and as well as I know many of our panelists are kind of real expert on this, and I'm looking forward to hear from them. In particular, I'm very honored to introduce my boss, Dr. Maria Neira, the director of the Department of Environment, Climate Change and Health in WHO. So Maria, she's just back from this famous COP26, and she was leading the WHO delegation on behalf of Dr. Tedros. So Maria, over to you for some initial message insights about climate and health. Why it's so important for WHO, and which are the connections between health and climate. Over.
Marina, thank you very much. And as is the classical sentence now to start a meeting, good morning, good afternoon, good evening. And as I see that there are many people from different parts of the world, I see that there are francophones, so soyez les bienvenus et merci beaucoup. There are people as well from Latin America, así que hola a todos, muy bienvenidos y gracias por estar con nosotros. And I'm sure there are many parts of the world. I see people from Africa, from all around the world. So it's a real pleasure to be with you. As a medical doctor myself, I have to express once again the incredible admiration and respect I have for the nurses. When I was a very young doctor training in a sophisticated hospital and then parachuted in a refugee camp in Central America, thanks God, I was very well surrounded by very experienced nurses, and thanks to that, I think we could do something sensible in that refugee camp in our healthcare center. If not, I will be really lost. So the pragmatic approach, the knowledge, the experience, and this capacity to always have a holistic approach of the problem is something that I always respected a lot. And I have to say that when we started to work on climate change and health, in WHO, they started many years ago, but it's true that among the first groups with whom we have been creating networks have been the nurses. And there was a very strong group and networks of nurses understanding, because they were really at the front of the responses, understanding that something was happening, that climate change, and particularly the natural disasters, the heat waves or the floodings or hurricanes, all of these natural disasters were putting their own community really at risk and increasing the demand for new expertise, for raising awareness, and for having a very strong response. So as I say, we are very happy to keep with this engagement with the nurses, and we count very much on your expertise and your support and then your advocacy movements, because we will need a lot of work from now on it. Very simple, and just in a few minutes, I'm sure that Marina was right when she says that you are probably very modest describing your knowledge about climate change and health. But if I needed to explain it in few words, it's very simple. The three pillars that we need for having health, for protecting our health: access to safe water, access to safe food, and access to clean air to breathe, and shelter, they are shaken now. They are at risk, and the risks are exacerbated by climate change. So imagine that the vector-borne diseases, the waterborne diseases will be now finding better conditions to transmit the diseases. And what we call in WHO the big killers, diarrheal diseases, malnutrition, and malaria, will have even better conditions to further spread and further increase the number and the risks for our healthcare. Imagine people without access to safe water, still breathing the air that is killing us literally. At the moment, I'm sure you heard this figure already, and if not, I'm sure that this is a scandal for you. 7 million premature deaths are occurring every year due to exposure to air that is not respecting the minimum conditions for us to breathe. So clearly climate change is putting and exacerbating those risks, creating an additional demand for the healthcare facilities, and at the same time responding to the needs of the community without any additional funds. So what do we need to do? Very simple. We need to work on keeping providing the evidence, and you need to, I'm sure you are contributing already to that. We have enough evidence proving that climate change is affecting our health, but we need to keep providing that evidence for policymakers not to have an excuse for going for more action. We need to adapt to climate change, because in any case, in many places around the world, climate change will be already affecting our health systems, and therefore we need to make sure that we have climate resilient healthcare facilities that will be better prepared to respond to the needs for those diseases that now will be having better conditions to increase their numbers, to have more prevalence. We need better epidemiological surveillance. We need training of the healthcare facilities workers. We need to recognize that those healthcare facilities will need an increase in the way they will respond to the scarcity, the water scarcity, vector-borne diseases, and the number of diseases, the increased number of diseases that they will see. On the other hand, we need to do as well mitigation. We need to make sure mitigation is like our primary prevention. We need to go to the causes of climate change. And one of the most important one is there are the emissions, the carbon emissions that are caused by, in a very big proportion, by the combustion of fossil fuels. The combustion of fossil fuels is becoming our public health enemy at the moment. We need to reduce those emissions, because not only they contribute to the global warming, but they contribute as well to air pollution. And again, air pollution, as I was saying before, is creating a massive public health emergency at the moment. At the moment we are talking, imagine that in India, in New Delhi, they are closing schools, they are stopping the construction sites, because of the smog in the city. They cannot see, they cannot breathe. Imagine, the same day that the Glasgow Climate Pact was signed, the same day that the world decided not to be too ambitious on the way they will be reducing emissions, they were not convinced of phasing out completely coal. That same day, New Delhi, one of the biggest cities in the world, was forced to stop activities because simply they couldn't breathe. I think we have an incredible paradox here, and probably something that as the public health community, we need to do more. So providing evidence, adaptation, mitigation, and of course doing some research that is needed, creating networks that are needed. And this is one of the powerful ones, because when we use the health argument and your credibility as members of the health community, as health professionals that have been very credible for many years, and according to our survey, is still very credible, we need to use those networks to put more pressure and keeping insisting with our politicians and our governments that this is not the way to go. And the last one is that as the health sector, we need as well to reduce our own emissions. Not only our healthcare facilities, they need to adapt and become more climate resilient, but they need as well to reduce our own emissions. Globally, if we put together all the health systems, the proportion of the emissions will be around 5% of the global ones. So imagine that our contribution on leading by example can be very important as well. And in Glasgow, this was one of the big initiatives that was adopted. 52 countries have decided to move on that under the UK presidency and WHO. And now we need to move. We need to help them to do it. We need to provide the tools for them to do it. And we need to lead by example. This is more than anything else a health crisis, and the health community needs to respond at the same level of ambition and speed that this horrible public health issue will need. So we count very much on all of you. I know that you, not only you will be engaged, but you will put your energy, your credibility, your networking and your movements. And I think this is irreversible. We need to change the way our societies are consuming, producing, recycling. And this change has to come probably from the health sector once again, but it will be a very positive and good mission, and the results will be on saving many, many millions of lives. So a good mission, a good strategy, good direction, what next? Let's start with that. Marina, over to you. We are on action already.
Thank you, Maria, thank you. And super inspiring as always. And then Maria told us that we have evidence, a very strong message. So, and we are very lucky here also to have another of my boss. I have to behave here as a moderator. And we have Jeremy Campbell-Landru, the head of the Climate Change and Health unit at the World Health Organization. And Jeremy will tell us more about the impact of climate change on population health, and will give us also an overview of the key message WHO and the health community brought to COP26. And Jeremy, I'm sure many of you follow him on social media, on this reporting from WHO webpage. He has been cycling to Glasgow. He had really done this amazing symbolic act of leading by example. So he cycled from Geneva to Glasgow. Well, he will tell us more maybe on the details of this experience, but then carrying with him the letter that you saw at the beginning in the video. The letter was signed by Dr. Tedros, and he ended up in COP, running after the COP presidency. Let's hear if he ended up delivering this, and which were the key message. Over to you, Jeremy.
Thanks very much, Marina. Marina introduces Maria and me as her bosses. That just means we're two people who do what Marina tells us to do, because she basically orchestrates all of our engagement, particularly with other partners and with the climate negotiations. If we could go to the next slide, please. So briefly, I'll just add a little bit more detail to what Maria has just laid out for us, and what Elizabeth also laid out for us, on the messages that we have taken as the health community to the big climate conference that took place in Glasgow over the last couple of weeks. Just one correction, Marina, I cycled half the way to Glasgow. I cycled to London and then handed over to a team of brilliant health workers from the National Health Service in the UK, so doctors and nurses, and I think perhaps midwives as well, who took the message the rest of the way to Glasgow. But briefly, the message that we took, if we can go to the next slide, please. Thank you. Is, as Maria has just outlined, the challenge with climate change to health is different to that for most of the diseases that we usually deal with, where we have a single individual communicable or non-communicable disease, where we're trying to get good public health interventions and to roll them out. And as Maria has just said, the challenge of climate change is that it undermines basically everything that we do on health around the world. So it makes extreme weather events more frequent and more severe. It makes it easier to transmit infectious diseases such as vector-borne diseases like malaria or dengue, or waterborne diseases, diarrhea, cholera, and so on. It interferes with our food supplies, and ultimately, so those of you particularly joining from the Pacific or other areas with low-lying populations know the sea level rise, which climate change is driving, threatens to wipe out whole nations. So it's actually an existential crisis for many populations around the world. And we not only know this from the global evidence, but we're hearing it reported directly back from countries themselves. All of the issues that I've just described, but also new issues that we were hardly aware of a few years ago, including a rapidly rising issue, which is the mental health concerns about the health impacts either of these extreme events or of the long-term damage of climate change, particularly on young people. Next slide, please. So we think that there are two major challenges for global health. One is increasing the resilience to all of those health impacts I've just described, but the other is one that Maria has also described, which is that we have to get carbon emissions down, including for the survival of some nations on the planet. And in order to do that, we have to drive down carbon emissions soon and deeply. So in the health sector, we have to get behind that, both by cutting carbon emissions within the health sector, but also a particular thing that we can bring from the health community is to make clear that there are massive health gains from the actions that we need to do to drive down carbon emissions. So it's actually a very hopeful and positive agenda. Next slide, please. And briefly, where the countries are on this, there has been a lot of progress in countries within the past few years, particularly around, for example, planning, assessing health impacts of climate change and developing adaptation plans and strategies. Also in including health within, to use some COP jargon, nationally determined contributions, which are effectively just the promises that countries make each 5 years to cut carbon emissions and to act on climate change. So most countries now cite health within them. But we do still have big challenges. One of them is that there is almost no finance coming from the climate mechanisms to protect health from climate change. And still only a few countries are actually assessing these health co-benefits that we've just described, even though these are very large. We've seen a lot of progress just within the last year or so in the run-up to the current COP, but these are the two big challenges that we have in terms of where the countries are. Next slide, please. One of the areas in which we have made progress is that this is the first conference of the parties. This is the 26th conference of the parties to the Climate Change Convention, which is too many conferences of the parties. We've been negotiating too long. This is the first one where there is actually a strong health program, including specific health initiatives led by the UK presidency. And you can see the titles of these here. And this is real progress for us. It's still not where it should be, but at least finally there has been an opening from the climate community to accept that health has a role to play, and that we can bring a positive engagement to this. And I think this is basically the program that we now have to build on. Next slide, please. So very quickly, I'll just run through the arguments that we took to the COP. This is the report that we launched about 2 weeks before the COP. It's published by WHO, but was developed in full consultation with the wider health community. I think we had about 400 health experts from various different communities, from national government, civil society experts, and so on, contributing to this. And the bottom line is that we came up with 10 recommendations, which I'll run through very quickly. Next slide, please. The first of these is, as the world has been dominated by COVID, we're now hopefully in most countries moving into the recovery phase. From very early on in the pandemic, WHO was clear that the investments that were going into national economies to recover from COVID had to be done in such a way as to protect the climate at the same time as protecting global health. And that means that the trillions of dollars that have been going in should be going into new clean industries and in health protection, not to the polluting industries of the past. Unfortunately, we're still seeing too much investment in those polluting industries. Next slide, please. The second is on placing health at the heart of the UN climate negotiations, because one of the points that we make is that health is not negotiable. In the climate discussions, there will be discussions about finance, technology transfer, and so on. But there is, in the Paris Agreement, there is a citation of the right to health. When we say right, we mean right. This is not something that can be traded away. And this is a group of effectively mothers campaigning for clean air who met with the president of the COP a couple of weeks ago, and they're not negotiating, they're just making clear that there is a right to clean air, a right to act on climate change, and that needs to be respected. Next slide, please. The next is on these nationally determined contributions, and our partners in the Global Climate and Health Alliance have been reviewing all of these, and all countries basically have to make these, and reviewing the extent to which they take account of health, either the impacts of climate change on health, or particularly the health co-benefits that can come from acting on climate change. And they grade them in these different demands. And what we see is that some countries are terrible, frankly. They don't cite health at all. Some are really good and do all the things we would expect. We think that every nationally determined contribution should include a full score on health. There is no reason why that should not be there. And so we're working to provide the technical support so that each country can do this. Next slide, please. The next is on building health resilience to climate risks, and I'll touch on this again briefly at the end, but basically we're asking all countries to sign up to commit to strengthen their health systems, to protect from those range of health risks that I've just described, to develop an adaptation plan, and also to seek funding either internally or from external funders to make sure that plan is implemented, because that's the bottleneck that we see at the moment. Next slide, please. Maria has touched on this, but we think there's a real priority to create energy systems that protect and improve climate and health. And she's just given you the example of what's happening in Delhi at the moment. That's happening all around the world. And as Maria has said, we lose, another way to put it is 13 lives each minute around the world to air pollution. And at the same time, we have many healthcare facilities and homes around the world that don't have any access to energy. So we think it will be a massive gain for health to address clean energy sources, but also energy access at the same time. Next slide, please. The next is on urban environments, transport and mobility. The reason for this is that about more than half of the world's population and more than 60% of greenhouse gas emissions are now associated with cities, and about a quarter of emissions, both air pollution and greenhouse gas emissions, come from transport systems. And we have the evidence that there are massive health gains to come from rethinking how we do things within cities. It includes things like electric cars, but much more important than that, it includes access to walking, cycling, public transport, green spaces, and so on. Next slide, please. A really basic one here is to restore nature as the foundation of our health, because all of our water, air, food, and also the protection from the risks of new diseases, such as the new infectious diseases that come out of the natural environment, effectively comes from protecting the natural environment. So we need to regain that connection between our human health and the health of the planet. Next slide, please. The 8th out of the 10 is on food systems. We know that they're absolutely critical to health. We know they're being threatened by climate change, but we also know that if we're able to promote healthy and more sustainable diets in line with the Paris Agreement and also in line with WHO's healthy diet guidelines, we would save, again, millions of lives around the year, while also having a massive impact on cutting greenhouse gas emissions. Next slide, please. The main objection to action on climate change is that it's expensive. It's not expensive when you consider the alternative of not acting on climate change. It's also not expensive when you think how much money the world spends effectively subsidizing the pollution which is killing us and also poisoning the planet. So around the world, the International Monetary Fund estimates that $5.9 trillion is spent each year as an effective subsidy to the fossil fuel industry, either in cash subsidies or the uncompensated damage to people's lungs from air pollution. That's more money than every health system in the world spends on health, every national health system. So imagine what that money could do if it went into financing a cleaner energy future, but also supporting health systems, the health workforce, and so on. Next slide, final slide on the recommendations is on mobilizing the health community for climate action. And as Marina kindly mentioned at the beginning, this year we did that literally, mobilizing the health community. We took this report, got it signed by Dr. Tedros. I cycled that from Geneva to London, at which point I handed over to this amazing group of National Health Service workers who then cycled it from Geneva to Glasgow as a signal of the mobilization of the health community, which is now coming on the climate crisis, because the climate crisis is a health crisis and people are starting to make this connection. And the next slide, I think, says why we think this is so important. Sorry, I'll deal with this one first. So we have concrete outcomes from the COP. You may be aware that the overall view of the COP outcome is that it's glass half full, or glass half empty, depending on how you look at it. It's significant progress from where we were a year ago, but it is nowhere near enough to drive down carbon emissions to the level we need. If every promise that was made by countries was met, we would still be on course for 2.4 degrees centigrade warming, not the 2 degrees centigrade, which is considered the absolute upper limit, or the 1.5 degrees centigrade, which is what the most vulnerable countries are rightly asking for. So we still need to do much more. On health, there is a citation to the right to health. It is good that phase down of coal is mentioned, and that phasing out of fossil fuel subsidies, inefficient fossil fuel subsidies is mentioned, but that's not as strong as it should be. We need to get out of coal fast. We need to get rid of fossil fuel subsidies very quickly. So those caveats don't help us. But on health itself, we think that a great deal of progress has been made. We have the first ever health pavilion running over 60 events inside and broadcasting to the outside world. We hosted our 4th Global Health and Climate Change Conference. And as Maria has said, we had more than 50 countries agreeing to commitments on increasing the resilience of health systems, and about the same number on making their health systems greener, so increasing sustainability in the health system. So we have really concrete things to work on. Next slide, please. And I think this is the final one, and it's our real reason for being so pleased to talk to you, is that we often say that the health community is the most trusted profession in the world. We usually point to doctors, or people usually point to doctors. I always insist on pointing out that according to the polls that I know, the only profession that is more trusted than doctors is nurses, or nurses and midwives. So it's really critically important that you have a role, not only in the day-to-day operations of addressing climate change, but also that you speak out on this issue. And we'll be very pleased to support you in any way you can, any way we can in doing that. So I think that's
Thank you, Diarmid. And you just mentioned that nurses are the most trusted professional. And then I'm very glad that we have several speaking after you, several nurses, and I'm very happy to introduce the next speaker, Susan Wilbur, the International Sustainability Director of Healthcare Without Harm. Susan, she is a nurse, but she's also an occupational environmental health specialist. And before joining Healthcare Without Harm, she used to be a dear colleague in the Department of Public Health and Environment, working a lot on Greening Hospital Initiative and many other interesting projects. But then over to Susan to tell us more about what she is doing to promote global green and healthy hospitals. Over to you, Susan.
Many thanks, Marina. And thank you, Diarmid and Maria Neira, for your important introductions. It is a real pleasure to be with you all today. Before joining Healthcare Without Harm, now almost 8 years ago, I was, as Marina said, working together with these colleagues in the department, but more important, I had the opportunity to meet many of you in the biannual meetings of the chief nursing officers. And it was always great to participate in those meetings. So good to be with you virtually and recalling those former days when we used to get to meet each other face to face. And I know that there was a great opportunity and struggle during the COP last week, the last 2 weeks, that people were able to join 20,000 strong, at least in Glasgow, including many of my colleagues from Healthcare Without Harm. And as Dermot talked about the climate and health program that occurred at the COP, I really encourage you to go to the websites. All of these programs are still online on the web and really interesting additional information. Next slide, please. I'm going to share with you information that is a bit broader than the issues of climate and health, but as Dermot was talking about in the health program about the importance of restoration of nature for health, the broad agenda of the Global Green and Healthy Hospitals Network. Next, please. This is a network of hospitals, healthcare facilities, health systems, health organizations, and individual health professionals, all of whom dedicated to reducing the environmental footprint of the health sector and promoting public and environmental health by raising awareness as we lead by example of how we demonstrate to other sectors of the economy. Next, please. There is the Global Green and Healthy Hospitals has as in its foundation a comprehensive framework of 10 interconnected goals for the health sector to address and promote greater sustainability and environmental health. And you can see on screen, in addition to the overarching goal of protecting health from climate change, we have these 10 goals: leadership, chemicals, waste, energy, water, transportation, food, pharmaceuticals. And some of you will be surprised to know that there are health systems taking on the sustainability of materials and pharmaceuticals, buildings, important building energy, and sustainable procurement or purchasing. Next slide. The network now has been growing. We just celebrated our 10th anniversary last month. There are over 1,500 members in 75 countries, representing over 40,000 healthcare facilities. And you can see on this map of the world that where the colored countries are where we have members of the Global Green and Healthy Hospitals Network. You also see on this map red stars for the 3 regional offices of Healthcare Without Harm in Brussels in Belgium, in Washington, D.C., and Manila in the Philippines. And you see red dots in areas where we have strategic partners with whom we work and share goals. And among those, you can see Sao Paulo in Brazil, Durban in South Africa, and Melbourne in Australia, as well as New Delhi and Beijing in China. Next, please. The Global Green and Healthy Hospitals Network is a project of Healthcare Without Harm. Healthcare Without Harm is a 25-year-old organization that many of you are familiar with and participate, where we work together to transform healthcare worldwide to reduce its environmental footprint while mobilizing its ethical, economic, and political influence to create an ecologically sustainable, equitable, and healthy world. And I think that is exactly what all of our health colleagues were doing last week, or the last 2 weeks in Glasgow in the Paris Agreement Committee of the Parties. And this is also evidenced in one of the slides that Dermot showed with the publication from WHO on climate resilient and environmentally sustainable healthcare facilities. Next, please. If you join, and you are all welcome to join the Global Green and Healthy Hospitals Network, and I'll show you how at the last slide, there are many programs and benefits ongoing This is a summary slide of those benefits that I'll talk about each briefly next. You already heard about the agenda. We have on a regular basis a series of webinars, as do our regional offices and partners. On screen, you can see some examples of recent seminars, and these are also archived on the website that we call GGHH Connect. Next, please. There are guidance documents in many of the goal areas. You see 4 of the guidance documents on screen. We have a new guidance document from last year on how healthcare facilities can integrate all of these goals through sustainable procurement. Next, please. There are case studies of hospitals and healthcare professionals in action in reducing their environmental footprint and improving sustainability. These are really fascinating examples of where health workers are taking leadership globally. Next. Within what we call GGHH Connect, which is a membership website, we have the Hippocrates Data Center. Next. The Data Center is within Connect, which is the website that is our own community of practice. And it is a real privilege to join today as you are launching the community of practice for nurses and midwives, and encourage you to also use this opportunity to interact. Next, please. The database, the data center called Hippocrates has a number of data collection tools around waste, energy, climate. Next, please. And here are an example of these self-assessment data forms that a hospital can enter their data and create summary charts and reports for reporting to their executive team, to their infection prevention and control team. Next. And these are what the dashboards look like. The dashboard in the front of the slide is one for the waste self-assessment, which documents the proportion. We have 2 different waste assessment tools, more complex, one is more simple, and you can illustrate what is the proportion of your infectious waste versus general waste, recyclable waste versus waste that needs to be specially treated. And as we know from the WHO manual on the safe management of healthcare waste, when well segregated, less than 15% of healthcare waste really needs special treatment. Next, please. The website and all of the data tools are in English, Spanish, and Portuguese, and the data set, the Connect database also allows for Google translation in many other languages. Next. And these are just a couple of our colleagues in this example from Australia and New Zealand, talking about how useful their interaction with other sustainability professionals and healthcare professionals are when they connect through the Global Green and Healthy Hospitals Network. Next, please. Dermot was demonstrating a number of WHO documents about the importance of resilient and sustainable health systems. Here is another example from the World Bank on climate smart healthcare. And the World Bank last week during the COP also launched a document about climate smart healthcare in COVID recovery, an important way of not losing. As we've seen over the past 2 years, many commitments to sustainability have been lost because of the pandemic. And these documents can help us think about how to integrate sustainability while fighting the pandemic. Next, please. As Maria Nero spoke about in the opening, and Dermot also demonstrated in his leading by example of cycling from Geneva to London. And Dermot, I'm really sorry I didn't get to join you on that trip. You know, that I would have enjoyed that. That as we in the health sector take leadership to transform our health sector to be resilient and sustainable, and work to influence as we work to end subsidies of fossil fuels, we can work then to transform the global economy by our example and influencing other sectors. Next, please. As I said, I was going to give you information about how you as individuals or the health systems with whom you work can join the Global Green and Healthy Hospitals Network. Go to greenhospitals.net. You will find a button to join the network. And here's an example of our colleagues in China that are working together with us on sustainability. Next, please. And with that, I want to thank you for your attention, and what a pleasure it is to be with you all today. And thanks, back over to you, Marina.
Thank you very much, Susan. Thank you. And then from one great nurse engaged in sustainability and greening hospital to another super engaged and great nurse, Kathy Offling. Kathy, she's the Executive Director of the Alliance of Nurses for Healthy Environments. We are running a little bit late, so I don't give too much of information about the bios of all our great speakers. You will find all the information and their bio also on the webpage that we will I will put actually on the, I will invite my colleagues to put on the chat, the webpage where you can find a lot of information that you are also requesting on the question and answer. We'll give some space as well to question and answer soon, but many of your questions I see are already answered by the products and the material that our speakers are already presenting, but we'll come back to you. Over to Kathy for more information on the roles that nurses can play on climate justice and climate action, and nurses drown down nurses climate challenge. This is the title of your presentation. Over to you, Kathy. And I think we missed each other in POP. You were there as well.
Yes, I was. Thank you so much. And next slide, please. I just wanted to say thank you so much to the WHO for your work elevating climate change as a critical health issue. And it's really exciting to have this new community of practice with a section on climate change. And I'm just really looking forward to seeing this community sharing ideas and supporting one another on this vital public health issue. Next slide. For those of you who may not know my organization, the Alliance of Nurses for Healthy Environments, we're based in the US, and we work with nurses and midwives around the globe at the intersection of health and the environment. And as Marina was saying, I had the honor of being at COP26 for the past 2 weeks, and it really highlighted for me how important nursing and midwifery leadership is now and will be over the next few years as we try to prevent the global temperature from increasing by more than 1.5 degrees Celsius. As the largest portion of the healthcare workforce and as one of the most trusted professions, we have a moral duty to work together and with our health colleagues to transform the health system into one that is regenerative instead of extractive. Next slide, please. While climate change is one of the biggest public health threats we currently face, I like to think it's also the greatest opportunity. When we address climate change, we can have an amazing impact on health globally and the health of future generations. And now more than ever, nurses and midwives are in the public eye and are being recognized for our leadership, compassion, and excellence in supporting health. And we are perfectly poised to help lead the charge in addressing climate change. Nurses and midwives are solutions people, and we know how to get things done. As I'll highlight in the next few slides, there's many tools we can utilize to help us engage in climate action. Whether you're just learning about climate change and health today and need a place to start, or you're experienced in climate change actions. Next slide. This past June, Patricia Butterfield, Jean Leffers, and Maribel Diaz-Vasquez published the paper, Nursing's Pivotal Role in Global Climate Action in the BMJ. They provided a framework for how nurses and midwives can expand their role in addressing climate change. The framework consists of 5 recommendations. Accelerate change by leapfrogging nurses into leadership roles, which includes elevating nurses into executive leadership roles, building partnerships globally amongst nursing organizations, and this last bit is very important, in paying nurses for their climate change work. The second is to give nurses and nursing students the skills they need to create the future. This includes mandating climate change and nursing education curriculum, integrating sustainability and climate change into professional education, and educating individuals, families, and communities to deal with mitigation, adaptation, and resilience strategies. The third is rekindle activism, advocacy, and relentless truth-telling by amplifying the voices of nurses and advocating for policies that promote planetary health, increase biodiversity, and decrease air and water pollution linked to climate change. The fourth is ensure a global lens by extinguishing Western biases in the climate action agenda of nursing, by promoting the voices of nurses in low and middle income countries within the climate change arena and adopt successful climate change strategies developed in low and middle income countries as models for countries across the globe. And the fifth is to put equity, justice, and morality front and center by including health equity in all climate action agendas, endorse an intercultural approach in Indigenous areas to guarantee the right to health and a healthy environment, and holding corporations and governments accountable for their roles in this climate emergency. They also provide a number of resources to help nurses and midwives begin to incorporate this framework into their practice. Next slide, please. For the past 6 months, nurses from North and South America and Europe have worked together on a global nursing agenda for climate justice. We just released the draft agenda on Friday at COP26. Climate justice nursing addresses the social, racial, economic, environmental, and multi-species justice issues of the climate crisis through centering the experiences and knowledges of frontline and fence-line communities and safeguarding the rights of nature to achieve planetary health. The agenda is organized into 5 domains: economics, ecology, ideologies, politics, and social systems. We are accepting comments on the agenda until December 12th. I invite all of you here today to take a look and provide comments. In support of the agenda, we've also released a special series of our podcast, Nurses for Healthy Environments, in which we spoke with nurse leaders from around the globe about their work in climate justice. These nurses are truly inspiring and show the depth and breadth of nursing and midwifery leadership in the climate justice space. On the next few slides, I'm going to describe a couple of resources that can be utilized by nurses and midwives to increase their knowledge around climate change and provide ways for them to engage at all skills levels. Next slide, please. The Nurses Drawdown Project is a project of the Alliance of Nurses for Healthy Environments and Project Drawdown. Founded in 2014, Project Drawdown is a nonprofit organization that seeks to help the world reach drawdown, the future point in time when levels of greenhouse gases in the atmosphere stop climbing and start to steadily decline. They are a leading resource for information and insight about evidence-based climate solutions. Next slide, please. With Nurses Drawdown, we decided to focus on 5 key areas of action. These action areas were chosen because of their significant connection to human health. Food is plant-rich diets, use of clean cook stoves, and reduced food waste. Mobility, we're focusing on bike infrastructure, walkable cities, and mass transit. Gender equity is for educating girls and access to family planning. Energy is supporting a clean energy future by promoting energy efficiency and advocating for a transition to renewable energy. And nature-based solutions, planting trees and protecting forests. Next slide, please. We invite all of you here today to commit to action on the Nurses Drawdown website, where we describe the links to health within the 5 action areas and provide examples of how nurses can take action within those 5 areas. We also have a strong social media presence and invite you to join us there. And we'd love to see videos and pictures of your actions related to climate change with the hashtag Nurses Drawdown. Next slide, please. We've also partnered with Healthcare Without Harm on the Nurses Climate Challenge. Our goal is to educate 50,000 health professionals, and we are almost halfway there with over 23,000 health professionals educated so far. The Nurses Climate Challenge provides a robust set of materials that make it easy for nurses and other health professionals to educate themselves and their colleagues on climate change and health, and provides examples of how nurses can support leadership and sustainability within the healthcare sector. These resources include PowerPoints that can be customized for nursing grand rounds and staff meetings and fact sheets. Next slide, please. I hope you find these tools and frameworks useful as we expand the numbers of nurses and midwives addressing climate change and incorporating it into your practice. Thank you so much for having me here today.
Thank you, Kathy. And let me move then to another great nurse, Patricia Naya Schwertletle. Well, Patricia or Trish, feel free to introduce yourself with a good pronunciation of your surname. Apologies for mispronouncing it. But Trish is a registered nurse with 15 years of experience, but also a global public health academic specializing on climate change and health. And then she's actually at the moment candidate for a PhD at the Heidelberg Institute of Global Health in Germany. And she will give us lots of, at least 3 stories of systemic change. And she will tell us how nurses can drive this change. Over to you, Trish, and feel free, of course, to repronounce your surname correctly.
That's fine, Marina. It's a complicated Mauritian and German combination, so it's fine. You can just call me Trish. Thanks very much for the opportunity to speak. We've just come back from COP26, and I think what really resonated with me is the nature and the scale of the change that's needed to stay under 1.5 degrees. It really is quite overwhelming. So there's 2 things that kind of happen with that shock. It can be quite empowering and motivating, but it can also be quite disempowering, and it's easy to despair at the thought of the change that's needed. But nurses, as the largest and most trusted group of health professionals, who also hold a very large proportion of the vote in many countries, have an important role to play, and as many of my colleagues have said here today, are very well placed to drive that change. But to mobilise towards systems change, nurses need to do many things, and 2 of those things would be, I would say, to empower ourselves and not wait for others to empower us, and also to better understand change, how change happens. And on that second point, I think there's 3 ways or 3 steps that we build health professionals that have been written about before. The first is to teach knowledge and skills to build experts. And the second is to teach values to build professionals. And the third is to teach advocacy skills so that we can create change agents. And the third step, I don't think we do very well. Nurses are good at advocating for individual patients and sometimes good at advocating for communities, but we're very new to advocating for planetary health, and that's something that we need to work on. I think sometimes we have to think less about the what that needs to change, but more about the how we're going to achieve that, because in many ways we have what I would call an implementation problem. And in order to understand change better, I think we need to recognise that the nature of change is changing. It used to be more about top-down change that's kind of executed through from the leadership down, but now it is very much about your ability to influence through a network, and that provides a great opportunity for nurses and midwives. So when I teach leadership to nurses and midwives at Monash University in Australia, I really teach it as leadership being a trait. It's not a role and it's not a job title. It's something as nurses and midwives we're all expected to practice. And basically, in its simplest form, it's about seeing a problem or an opportunity and doing something about it, and not really waiting for somebody to give you permission or to tell you how to do it. And there's a great need for that now, as so many countries have signed up and committed to climate resilient and sustainable health systems. So I'm just going to briefly explain 3 stories of change that I led that could be replicated in many different settings. One story is about education, one about governance, and then the final one about research. So first of all, education. we were able to integrate education for sustainable healthcare into the undergraduate curriculum for nurses and midwives at Monash University. So now there are learning objectives in the curriculum that are assessed. And once I left, this curriculum didn't rely on me. It has to be taught by the people coming after. So that's an important element when you initiate change that doesn't depend on you, I think. This story is pretty much about windows and doors in terms of change. It's a good way to think about change, I think. The windows are like pockets of opportunities that come up where you can influence. And the opportunity here, or the window, was curriculum review. So every 7 years, the curriculum for health professionals is reviewed, and it could be different in different countries, but generally around 5 to 7 years. So if you're the right person at the right time in the right place, you can effectively integrate climate change in health and sustainability learning objectives into the curriculum so that the next generation of health professionals has a higher level of climate literacy and will be able to drive even more change. The other way to think about change is through doors. So often you can push on doors and sometimes they don't budge at all. Sometimes they open a little bit so you can get your foot in, and other times they just slam in your face. But it is really important to keep pushing on those doors and also to recognize those pockets of opportunity. Sometimes they come up and they pass without you realizing that they're there. Curriculum review would be one example. Another would be if your professional body is reviewing their code of ethics, in which case climate change and health and sustainability should definitely be part of your code of ethics. It could be the competency standards are getting routinely reviewed, or maybe your health organisation is doing a survey to gain better understanding and updating their vision statement for the organisation that you work for, in which case you really want to get climate change and health and sustainability into that vision statement. The second story of change I have is about governance. So since about 2007, I've been involved with Doctors Without Borders, Médecins Sans Frontières. And I think this is a story of effective advocacy. Although Doctors Without Borders is called Doctors Without Borders, almost or over half of the health workforce is made up of nurses and midwives. And this is really a story about existing change levers and creating new change levers. So many of us are privileged enough to live in democracies, and we have to start thinking of ourselves as citizens rather than customers. Within the movement of MSF, which is one of the world's largest emergency medical humanitarian organisations, there is a motions process. So this is what I would call an existing lever of change. Once you've done a project with MSF, you join the association, and the association really guides and shapes the movement and the change in the movement. So there was an opportunity to write a motion, and if the motion gets enough support, it can actually rise to the highest level of governance in the movement, which is the International General Assembly. We wrote a motion to ask MSF to invest more and to acknowledge the work of nurses and midwives within the movement. And this it was motivated to improve quality and access to healthcare. We asked MSF to invest more and acknowledge nurses and midwives, to integrate nursing and midwifery research into the operational research strategy, to ensure nurses are included in decision-making, and to provide professional development and promotional pathways for nurses, and also to ensure that nurses are working at their full potential. So this story of change isn't really specifically about climate change, but I believe that when you invest in nurses and midwives, you invest in the nursing and midwifery philosophy, which is quite different to medicine, because it incorporates the socio-environmental model of health a little bit less than the biomedical model of health. And in that way, it's reorientated towards prevention, which we know is the lowest emitting form of healthcare. It's also more community, the philosophy of nursing is also community orientated, which is really important for climate action. The third story of change is about research. I think research has an enormous power to change because there's nothing more infectious than an idea. A part of doing research is addressing gaps and sometimes producing academic articles, but it's also an opportunity to think strategically. How can you create knowledge that will set off a cascade of systemic change. There's a couple of good examples of this. One is the body of research around health co-benefits. So researchers got together and actually measured that when you invest in mitigation activities to reduce the emissions of healthcare, there are actually health, social and economic benefits. So this body of research really provides a very powerful and compelling argument for policymakers to integrate mitigation into their policy frameworks. I think the other research that I really like is synthesis research. So instead of conducting primary research, you can bring together all that is known about a certain topic, and in that way you raise the level of evidence and it is more likely to be integrated in policy and bring about change. At the first COP, there was an assessment report that integrated 2,000 academic articles on climate change. And this year at COP21, we undertook the assessment report 6, which required that 350,000 articles on climate change were synthesized. So from 2,000 to 350,000. There's an amazing amount of evidence out there. So it's good to ask yourself the question, is primary research needed, or would it bring about more systemic change if I was to synthesize this research? So just to summarize, the scale of the change is really overwhelming and we all have an important role to play. So it's important not to exclude anyone. We need to think less about the what and more about the how of change, because effective advocacy is really about knowing how change works. 2 ways to think about this is windows and doors, and also existing change levers and creating new change levers. I gave 3 examples of this that could be replicated in other settings about education, governance and research. At COP26, one of the driving messages was really health needs to be at the centre of climate policy. And as the largest group of health professionals, we are really well placed to initiate that change. And for that, we need to have nurses at every decision-making table. Thank you.
Thank you very much, Trish. And well, we arrive now at the very important part of this webinar where we want to give you the time to raise questions. You have done it. We are monitoring all your great questions on the question and answer chat. And there are many, and I see also our speakers are very diligently responding to some of them. And thank you very much for all of you that have taken the time to answer and give the answer. Many of you are requesting materials, presentation, guidance, and I see most of your questions are responded already on. So I'm not going to address all these questions because you can actually read the answer directly on the chat. But also I've been reminded that when another way to stay in touch, to be informed and continue dialogue is also to subscribe to the Nursing and Midwifery Global Community of Practice. And then maybe I can ask colleagues to put in the chat again the link on the webpage where you can subscribe, remain in connection, raise your question, get more information. So maybe, and also we are running a little bit late, maybe I just pick one of the questions that have not been answered already. And let me see, from Maldives, Miriam Uda, she is raising the issue about an enormous issue is the waste management, which could be contributing towards the increasing number of other public health issues. So any guidance or work that has been done with special focus to low-income country, I guess, and country with lack of resources in addressing such an issue. I think some guidance has been already suggested by Susan. I don't know if I can go back to Susan if you want to highlight some of the key resources and ongoing work that the public health community, Healthcare Without Harm, others are doing on waste management. Can I ask you, Susan, or any other speaker who wants to intervene? Of course, feel free.
Thanks, Marina. Yes, I put in the question and answer links to the recent WHO publications on wash, water, sanitation, waste, hygiene around COVID specifically, but it reflects back on the WHO manual on the safe management of healthcare waste. For our colleagues in the Maldives, there is a specific document from WHO Maldives on waste management that is fairly recent. And I know that one of my colleagues will be traveling in the next year to Maldives to support the implementation of that work. So thanks for the question. There were other links I put up to the Global Green and Healthy Hospitals waste management guidelines. And I forgot to mention the climate impact checkup tool that is a part of that Hippocrates database that has some of the data sets related to waste management and its impact on greenhouse gas emissions. You may want to contact Marina later to know more about the WHO version of that climate impact tool. And there's a number of other links to WHO guidance documents on air pollution, on air quality, and on waste that I put in the Q&A chat.
Great, thank you, Susan. And maybe let me pick quickly another question on air pollution from Catherine, asking whether WHO has guidance or strategy to address this issue. I believe Maria Neira has left us, but maybe Diarmid, sorry to call on you. Maybe we want to just quickly tell people about our newly released guidelines. Sorry, over to you.
Yes, sure, thanks. And it's a very good question because the two issues are very closely linked as well. A large proportion pollution burden. About 2/3 of that comes from the burning of fossil fuels.
Sorry, I wanted to suggest that you put down your video. Your Wi-Fi connection is not very good. Maybe it's helping with you. Yeah, go ahead. Sorry to interrupt.
Okay, just briefly, the two issues, climate change and air pollution, are very closely linked because there's a large overlap between the sources of greenhouse gases and of the air pollution, which is killing this 7 million people. What we do have from WHO is air quality guidelines. So we recently updated these. I think it was this year or last year we published the update. This year, I think. And in fact, the guideline levels are lower than they were previously. So basically, there is almost no bottom limit on the level of air pollution that causes damage to people's health. And that means that, according to our estimates, more than 90% of the world's population, well over 90%, breathe air which is hazardous to their health. Where we don't have so much direct guidance is on exactly what you should do about that, because most of those emissions come from outside of the health sector. And I think this is an area where we have to move forward as a community, because we're quite used to talking to ministries of health about individual treatments and so on. We feel less comfortable stepping out of our comfort zone and telling a Ministry of Transport or a Ministry of Energy what to do. But I think we do need to move on to that territory now, because otherwise we're effectively just treating people and then sending them back out into an environment which is killing them. So we have the guideline values, but we need to do more on actually directing people on solutions.
Thank you, Diarmid. Thank you very much. And I'm afraid we don't have more time for more questions, but again, it's great to see the exchange on the question and answer chat. Philip, I will kindly ask all the speakers also to have a look and respond to the question that are addressed to them, or they feel comfortable in giving an answer. And then we move to the last presentation by our colleague Kerry McCarthy, and the technical officer in the health workforce team at the WHO. Dr. Kerry, over to you for some climate change and the strategic direction for nursing and midwifery. Without further ado, since we are running out of time, Kerry, over to you.
Thank you, Marina. And it's nice to follow after that question, because I can complement a bit where Diarmid left off. So next slide, please. Even when he left off with his other presentations with the 10 recommendations in the WHO Special Report on Climate Change and Health. As he mentioned, recommendation 10 was on preparing and enabling the health workforce to anticipate, recognize, and treat health manifestations of the climate crisis, and also to contribute to reducing the environmental footprint of healthcare and to systems that are resilient and well-functioning. And as you can see in these action points from that 10th recommendation, they include updates to health curricula for health occupational groups and students, providing additional and continued training and support programs on climate change and health, and updating those health professional education and practice standards to include competencies on climate and health. And we heard some fantastic examples, resources in this webinar with respect to these. I also wanted to share some applicable WHO global resources for health and care workers in both practice and academic settings to respond to that last question. And many of these are at the policy level, and they're great because they've received explicit endorsement from the ministries of health representing WHO member states at the World Health Assembly. Next slide. So beginning in 2013 and continuing with the 2030 agenda for health and care workers, there's global policy guidance for education, which includes the accountability mechanisms to identify and address the needed health competencies to ensure updated and contextually relevant curricula, and to take actions to strengthen those faculty and students' competencies, as well as make sure that those institutions meet updated quality standards to enforce them. So all those things that were in those action points. These first two documents on the left were adopted with World Health Assembly resolutions. There's also another upcoming resource entitled Integrating Social Determinants of Health into Health Workforce Education and Training, obviously inclusive of environmental factors from climate change impacting upon health. Next slide, please. In all of these resources, competency-based education is positioned as the most effective way of training health workers. So it's not just about them knowing the health impacts of climate change, but being able to incorporate this knowledge into practice. And so to get very practical with the how-to of adapting curricula to be competency-based and respond to the social determinants of health, including environmental factors, the competency framework, the global competency framework and outcomes for UHC is going to be released very shortly. The global competency framework emphasizes population health and advocacy, so content about advocating for and with individuals and communities, supporting individuals and populations to identify and be responsive to these environmental factors and determinants of health, and to better provide health services to address the health impacts of climate change. And the related course offerings in the WHO Academy are underpinned with this competency-based education approach for adult learning. Lastly on this, there will be a global competency standards for refugee and migrant services, a derivative from the global competency framework for UHC, and this will include for individuals and populations that are displaced because of climate related issues and disasters. Next slide. But today we're talking about nurses and midwives, their preparation and education, their competency and leadership in recognizing and addressing the various manifestations of climate change on health. So as Elizabeth mentioned at the outset, there is a new global agenda for nursing and midwifery that can be applied to do just that. The Global Strategic Directions for Nursing and Midwifery 2021-2025. They are 12 prioritized policies for nursing and midwifery in the areas of jobs, education, leadership, and service delivery. This document also has been through the World Health Assembly and adopted by all the health ministers at the 74th World Health Assembly with a resolution specific on nurses and midwives. So those same areas that we saw from recommendation 10 in the climate change and health report about education programs, trainings and supports, standards and regulations that uphold the quality and relevance of those, and the leadership to effectively communicate and make changes, those are all in the global strategic directions for nursing and midwifery. As you can see on this slide, there's a policy, for example, to ensure education is responsive to population health and is competency-based. There's a policy on ensuring practice standards and regulations, one on ensuring the workplace provides essential supports and training so health workers are the most effective they can be in practice settings. So this is exactly the type of higher level policy guidance that can be cited and leveraged and applied in the content essential for nurses and midwives in our current global climate change crisis. So I hope it will be useful to you by providing some backing and traction for advancing some of the specific work on climate change and health we talked about for nurses today. It's available on our website, and in the next coming months, all of the UN languages versions will be published as well. Thank you.
Thank you very much. Thank you, Carrie. And then with you, we have actually concluded our list of speakers, and then and as you can see, we are running out of time. But we are really glad to see that more than 250 participants, they stayed with us from the first minute until now. So we don't want to keep you longer than this. You heard about the message. You heard there is a global health community made of doctors, nurses, midwives, health professionals. Really, in March, as Maria Nera mentioned at the beginning, we have done a lot for COP26. COP26 concluded with results that were a little bit less ambitious than we were expecting, but we had an enormous energy from the health community, a lot of activities. We launched this important building the health resilience of the health sector and investing on sustainability and lowering the carbon footprint of healthcare facility initiatives. They are great initiatives. They started with COP26. They are not ending in Glasgow. On the opposite, we are carrying on the collaboration and the joint effort towards COP27. Unfortunately, another COP. This one will be in the Africa region, well, Embro for WHO because it's in Egypt. But the key topics and focus of this upcoming COP is resilience and adaptation. So more work to do together. The health community and the nurses and midwifery community are together, and we have the tools, we have the initiative, we have the leadership and the will to do more together. And then thanks to this webinar, we are actually starting also a great community of practice experience. And so once again, please sign up to the Global Community of Practice website. Stay in contact. If you like this webinar, please, and you know that you have colleagues in other time zone that didn't make it to this one because it was not convenient, we will repeat another webinar like this one on the 18th of November. If I'm not mistaken, it will be at 7 o'clock Geneva time. And then, well, again, I want to thank all the organizers and the interpreters that have done a great job. This webinar was translated in several official UN languages. And again, I would love to say much more, but then I see we are really running out of time. So I want just to conclude by thank you and again addressing you to this important webpage, nurseryandmidwiferyglobal.org. Thank you very much and have a nice rest of your day. Bye.